Among the statues outside the Alabama state capitol is one of J. Marion Sims, a 19th century surgeon considered a pioneer of gynecology. While he is recognized for advancements in childbirth, it was how he learned to do so, experimenting on enslaved people, that has earned him scorn.
This man who's known as the father of gynecology, but actually mangled and dismembered and tortured these women, men and children. His statue is at our state's capitol. I'm appalled. I still have a chip on my shoulder.
Michelle Browder is an artist in Montgomery, Alabama. She created an alternative to the statue of Sims, 3 sculptures of enslaved black women Sims experimented on.
There's a gynecological tool here. This represents the sutures.
She says her sculptures tell not just of what happened, but of how what happened then still reflects health care for black women today. It's a system critics say continues to diminish African American females and downplay their symptoms.
We're dying from cervical cancer. We're dying from fibroid tumors because people don't listen to us. We're not believed when we speak or we're taken seriously. And so that is why the mothers are here today.
A recent investigation by the Associated Press reported that black women have the highest maternal mortality rates in the country, nearly 70 per 100,000 live births in 2021. That's almost 3 times the rate for white women. Even college-educated black women have rates much higher than white females. Many black women feel disrespected by their doctors, that their reporting of symptoms is often ignored.
I feel like they are taught that our pain levels are not that bad, and that's not true.
Angelica Lyons was pregnant when she began to suffer severe stomach pains. A Birmingham, Alabama public health instructor, Lyons says she pled for help, but says she was ignored by medical staff and repeatedly sent home from the hospital. Finally, when her baby's heart rate dropped dangerously low months before she was due, she was rushed to the emergency room for a cesarean section. She nearly died of an undiagnosed case of sepsis.
It's scary knowing that I could have died. I couldn't, that my mom, my sister, my ex-husband would have to be, taking care of my son, and I wouldn't be here.
Dr. Meredith McMullen, a San Diego OBGYN, says black American women have a higher mortality rate for a number of reasons.
Some of that is because of pre-existing conditions. Some of that is because an implicit bias exists within our medical system.
That bias can range from lack of access to medical facilities to subpar treatment. One recent study by the National Institutes of Health documented how medical providers were less likely to recognize pain in the faces of black patients than in non-black patients.
I got into bed. I felt this strong pain from my vaginal area all the way up to my chest. I didn't know what was going on. That was literally the beginning of them constantly leaving me in pain.
Dr. McMullen says black women are more susceptible to some medical conditions that caregivers need to pay attention to, like hypertension, which could lead to preeclampsia.
The preeclampsia can turn into, if left untreated, severe blood pressures that can then result in seizures.
Dr. McMullen says one key to improving black maternal health would be to have labor and delivery teams more closely reflect those they are caring for. Tammy Eswick, Scripps News, New Orleans.